Member.
Thank you, Honourable Chair. Just before we finish off with this clause, I just want to reiterate that this legislation isn't going to solve the problem of public drug use. It's not going to solve the problems that are contributing to public drug use, which is poverty and trauma and homelessness and lack of available services that people need. This is legislation that I think is very much creating the risk of adding additional stigma to people who are already the most stigmatized people in the public, in our communities. And they pay for that stigma with their lives, their health. They pay for that stigma by already being excluded from public life in so many ways. And so reacting to a public health emergency in a way like this exacerbates that health emergency. Just want to put on the record an excerpt from a speech from an NDP Member of Parliament, Gord Johns. He brought a private member's bill, Bill C-216, to the Parliament. He said, "We need to listen to experts. It's so important that everybody in the House listen to experts. I traveled across this country when I was talking about my bill, Bill C-216, which was just a reflection of the expert task force on substance use. I was able to meet with people on the front line of this crisis, such as people who use substances and experts, and the whole time they encouraged us to listen to the report. The Canadian Association of Chiefs of Police of Canada, as I have cited, has come forward very much in alignment with the expert task force and actually had a seat on that task force. The task force was unanimous in that we need to stop criminalizing people who use substances. We need to expunge records of people who have been charged with personal possession, and we need to ensure that people have access to a safe supply and treatment on demand. So we meet them where they are at, and we invest in recovery, education, and prevention, because we know that when people relapse, we need to catch them, but we also need to meet them where they are at through the whole thing." It's interesting to me, Honourable Chair, that the federal NDP sounds a lot more like the BC Greens on this issue than the provincial NDP. We've canvassed the minister for days on this bill about what informed it, how much it will cost, what are the expected outcomes, what are the alternatives to the locations that are identified in this bill, and we've gotten pretty unimpressive answers. And I think that that speaks to the fact that this bill isn't a solution to the problem that people in our communities are seeing and feeling and experiencing. And those experiences and those sentiments and what people are experiencing are valid and serious and true. But this bill isn't going to fix that. It's not. Because people don't need more stigmatization. They don't need more policing and enforcement. People need places to live. They need services and supports. They need governments to rebuild the social safety net that's gone. This is a reactionary piece of legislation. And a year from now, it won't have solved the problems in communities. It won't have made these problems go away. We have actually probably contributed to harm even in the debate of this bill. Because at times it feels like, who wants to marginalize people most? These are human beings in our communities who need people in rooms like this, with this privilege, with this amount of resources available, people in rooms like this to want to fix things. That's not what this legislation is going to do. And with the amendments that were brought in by the minister, it's actually going to make it worse. I want to go to my community and say, when solutions come forward, like the village site, which sees an 18% decrease in crime, that's the kind of data that I'm talking about. That's the kind of informed and evidence-based decision-making that I'm talking about. That's what I'd like to see this government invest more of. What works? What helps people? What gives people a place to live and dignity and health and well-being and gets them employed and moves them back into the place they belong as a true part of our communities, as a part of the public that we actually care about? It's a sad place we're at, less than a year after the introduction of the Health Committee report, where we had unanimous consent in this House for action on this, none of which involved more criminalization of people. It involved investing in a continuum of care and recognizing that the social determinants of health should be determining policy and lawmaking in this House. We serve people. We serve all the people. I don't have a question, but I just wanted to put that on the record.